What if the next time you rushed someone to the ER, the computers were down? In 2024, ransomware attacks disrupted hospitals in 46 U.S. states. One system lost over $100 million per day. Another had to switch to pen and paper, causing infant dosing errors and delayed cancer treatments. This isn't a hypothetical. It's already happening. We covered this topic in more depth on the blog last week. The link's below if you want full sources and tools. But here, let's break it down visually. At Quantum Cyber AI, we track the digital threats shaping our health systems and national infrastructure. And right now, hospital cybersecurity is failing in ways that are harming real people. Let's start with the numbers. In 2023, healthcare data breaches hit record highs. Ransomware accounted for a third of those incidents. In 1 year alone, 92% of healthcare providers reported at least one cyber attack. These aren't just stolen records, they're system-wide disruptions, surgeries canceled, ambulances rerouted, and hospital staff pushed to make life and death decisions without reliable data. Ascension Health was hit in May 2024. They operate 140 hospitals. The breach took out electronic records, lab systems, pharmacy access, and imaging. Teams had to revert to handwritten documentation, and nurses reported near misses involving pediatric dosing. The Change Healthcare breach in February 2024 was even bigger. It froze insurance billing, halted prescriptions, and created billions in financial losses. And that wasn't even a direct hospital hack. It was a vendor failure. This highlights a core problem. Hospitals depend on third-party platforms that aren't held to the same security standards. One collapse brings down the entire system. So why are hospitals still so vulnerable? Part of the issue is infrastructure. Many providers still run outdated operating systems and unpatched devices. Infusion pumps, ventilators, and diagnostic tools are often connected to main hospital networks without encryption or segmentation. Once hackers gain access, they can move laterally and lock down everything. Another problem? Funding. Rural hospitals often operate on razor-thin margins. Some can't afford secure backups or even basic endpoint protection. Cybersecurity becomes the first thing to get postponed until it's too late. Then there's the human element. Most clinical staff don't receive cybersecurity training. Few hospitals run incident response drills. When attacks hit, teams are unprepared. Communication breaks down. Recovery is delayed. Lives are put at risk. We also need to talk about mortality. Yes, deaths. One peer-reviewed study found that breaches correlate with increased 30-day mortality after heart attacks. That means cyber attacks are reversing national gains in patient outcomes. Another report from IBM linked ransomware to higher cardiac arrest deaths due to ER shutdowns and delayed care. The psychological toll is real too. Frontline providers report moral distress. Patients lose trust when treatment is disrupted or their records are exposed. And families impacted by these breaches are left wondering why no one stopped it. The most disturbing part, most of these failures were preventable. In our full post, we outlined 7 of the worst cases, from Ascension and Change Healthcare to a CrowdStrike outage that triggered failures globally. So what can be done? Hospitals must prioritize patch management, isolate vulnerable devices, and ensure all data is encrypted in storage and in transit. Vendors need to meet the same cybersecurity standards as providers, and we need mandatory federal frameworks, not just HIPAA-era guidelines that ignore modern threats. Policymakers should fund upgrades for under-resourced hospitals. Patients deserve transparency when breaches occur, and the healthcare sector needs a dedicated platform for real-time threat intelligence sharing. Because right now, hospitals are being picked off one by one, and no one is connecting the dots. At Quantum Cyber AI, We're focused on tracking these systemic failures before they spiral further. If you found this breakdown useful, subscribe to the channel, drop your questions in the comments, and check out the full article linked below. We've got more coming on AI-powered cyber attacks, digital identity risks, and the real-world consequences of tech policy gaps. If this breakdown helped clarify what's really going on in hospital cybersecurity, hit the like button, subscribe to the channel, and leave a comment with your take. Thanks for watching, and stay safe out there.